Xavian.
Hi, I'm Stephanie.
And I'm Yvette.
Welcome back to Medicare at 65, Kitchen Table Conversation with Simplicity Advisory Group. We are a Medicare plan center where we work for you and not for the insurance company. Today, we are going to talk about some 5 common mistakes that people make. So grab a cup of coffee, like and subscribe, and please share with a friend.
We at Simplicity Advisory Group, we help seniors, individuals with disabilities that may or may not have Medicaid. We also work with families who are navigating for a loved one the Medicare process and their health insurance options. So again, today we're talking about one of the most important topics of anyone approaching retirement age or turning 65. Medicare mistakes that people make when turning 65.
These mistakes can be very costly. So if you want to avoid those penalties and avoiding those deadlines, it's very important to reach out to trusted advisors like ourselves at Simplicity Advisory Group.
Actually, so if you're turning 65, you're helping a loved one or just planning ahead, this is a conversation for you. We definitely want you to hear what we have to say. We're not here to waste your time. Grab a cup of coffee, like, and subscribe.
One of the biggest mistakes that we see in the industry a lot is people assuming that Medicare enrollment is automatic for everyone, and that's just not so.
That sure isn't, and that's why, and that's not always true for everyone. Mm-hmm. So if you're not already taking Social Security, perhaps maybe on Medicaid, which is a state program, benefits, or receiving state assistance, you most likely need to enroll or take action.
That's right. Missing an enrollment period can be very crucial, right? It can cost you a lifetime of penalties. So if you don't enroll in that time, in that Part B, you can face a 10% penalty for every month that you go without having it. And not to mention that 1% penalty for every month that you go without the prescription drug plan.
Absolutely.
So it's really important not to miss those deadlines and things like that.
Absolutely.
Yeah.
And many of us would be surprised to know that millions of Medicare beneficiaries face late enrollment penalties each year. And roughly 700,000 are paying penalties for not enrolling in the right time for Medicare Part B. And that's up to about 2.5 million paying a penalty for late enrollments for your prescription drugs. And not to mention that these penalties will increase your Part B premium, which is a monthly premium that you have to incur. And these are probably at up to about 30% of your Part B premium, and that is a lifetime. So that's why understanding your initial enrollment period is so important. And your initial enrollment period is a window between 7 months long. It's a 7-month long window. So if you're looking at your 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after. So during this time, you can take action, and it's important that you do that. So keep in mind, there are special enrollment periods that may follow or fall under your circumstances if you don't need to enroll, like if you're still working. Okay.
Yeah, and I think what's surprising is that a lot of people think that original Medicare covers everything, right?
Exactly.
Which it does not.
Absolutely.
Original Medicare has 2 parts. It has A, which covers hospitalization. It has B, which covers physicians. So you're entitled to Part A, right?
Correct.
So in Part A, you work 10 years or 40 quarters, I believe it is, right? So 40 quarters. And Part B, you have a premium. And I think that premium is a $202.90 for this year.
Yeah. But just keep in mind, it could be a little higher if your income is above $100,000.
It is depending on your income. Yes, thank you.
So
that's so true.
All right. So understanding your initial enrollment period is very important. And this period can last 7 months long. 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after. So during this time, you can take action. You usually can't take action before that window opens.
That's right.
So keep in mind, there may be special enrollment periods as well. If you continue to work beyond 65th birthday, you may have a special enrollment when you decide to retire at that time. So special enrollments may or may not fit your circumstances, and we just need to be aware of those as well.
Yeah. I think one of the biggest surprises is that that I found
Right.
is that people just assume that original Medicare covers everything, and it does not. Original Medicare have two parts to it. There's Part A that covers your hospitalization. There's your Part B, and that covers your physician visits. So you're entitled to Part A as long as you've worked 10 quarters and four, or is it 10 quarters?
10
No, 10
years.
years.
10
I'm sorry.
years and 40
10
quarters.
years and 40 quarters. And then you have the Part B that you do have a premium for. Usually that Part B premium is $202.90.
Right, for 2026.
Right.
Yeah. And it changes, every
And
year.
it changes, right?
Yeah, so-
and again, you have to keep in mind that depends on your income, right? So it could be $202.90, or it could be more if you make, I think it's over $100,000.
Correct.
So if it's over, you're over $100,000 a year, then that Part B premium could be more.
Absolutely. And then, you think about things like dental, vision, and hearing and long-term care often are not fully covered under
That's right.
original Medicare. Original Medicare picks up about 80% of your care, like Stephanie mentioned, outpatient and inpatient care, but 20% is what you actually are responsible for.
That's right.
And so, therefore, these are expenses we have to consider when you're making your decisions about your health insurance and healthcare coverage.
Right. So, like you said, you want to be mindful of making those decisions because those costs can add up so quickly.
Absolutely.
Right.
Yeah.
So you want to be mindful of the choices that you're making.
Yeah, and as Simplicity Advisory Group, that's why it's very important for us to review all your options carefully and understand your healthcare needs from the beginning. And
That's
that
right.
also includes, your prescription drugs, your doctors and specialists that you see.
So not reviewing prescription coverage can be a costly mistake, right?
Absolutely.
So I see that happen. That's pretty common that people overlook prescription drug costs.
Absolutely.
And assuming that it's covered under original Medicare.
Exactly.
Right?
Yeah.
It's not covered under original Medicare. Again, like I said, we can't emphasize that enough. Original Medicare only consists of two parts. Part A, hospitalization. Part B, physicians.
Good.
Part D is your prescription drug coverage. It is not covered under original Medicare. So that's a common mistake that a lot of people make, is assuming that.
And that they also assume or believe that all medications or prescriptions are covered under a plan.
Yeah.
So, but that's not true either because all formularies are different based on the insurance
Absolutely.
carrier. And so having an ideal and knowing what your prescription drugs are and you carefully want to review and make sure that it's covered under the plan that you choose.
Yeah, and choosing the wrong plan could be costly. A lot of out-of-pocket costs, and you don't want any more out-of-pocket costs than you have to have.
Exactly.
You're already paying that $202.90 a month, and you don't want anything else, right?
Yeah.
So if you can avoid any more out-of-pocket costs, do that.
And so having said that, when you meet with Simplicity Advisory Group, our team will review your medications. And when we ask you for that, we're asking for not just your medications, but how often you take them, your dosage, and your pharmacy is equally important because there's a preferred pharmacy and a standard mail order. So these are things that you would have to carefully consider and make sure that it means a lot to you. If it means a lot to you, that was covered.
Yeah.
Okay.
Yeah, and choosing the right prescription plan could mean saving some money, right? Choosing the wrong one could be very costly.
Yeah,
So
exactly.
low premiums sound really attractive. So that's why choosing that right premium or that right prescription drug plan is important.
Yeah, and in fact, monthly premium is only one piece of the puzzle.
That's
you have to
it.
consider a lot of different options. And due to the Inflation Reduction Act that happened probably a couple of years ago, you'll see that, premium options may be a better fit based on other costs and other needs that you may have.
Yeah. So you also may want to consider the fact that you have deductibles, you have co-payments, provider networks, and prescription costs, right? So you want to make sure when you're sitting down with an advisor like ourselves that you're covering your providers, right?
Absolutely.
What providers are covered in this plan, and are my prescriptions covered on that plans and formulary?
Exactly. So
important.
our goal is to find a plan that fits your healthcare needs.
Right.
Your care needs is probably the most important. And then we have to look at your budget. right? Not just the lowest price.
Right.
So again, we'll take a deep dive. We'll compare to what you have now, and then look at what your options to really help you come up with a plan that fits your needs.
Yeah, so trying to figure all this out alone can be very overwhelming, especially with all the mailing you have, all the television commercials, even radio is involved now,
Exactly.
right? You turn on the radio and you're hearing all this now, right?
Yeah,
So that's
absolutely.
important. So the information that you receive can be overwhelming. And that's why with sitting down with a trusted advisor like ourselves can make the process a little more smoother.
Yeah.
I mean, you may not walk out knowing it all, right? But it's definitely going to make things smoother.
Absolutely. And unfortunately, many people do make the mistake of rushing into this decision. Maybe they'll get a phone call and they'll decide right then and there.
Yeah.
But again, it's more involved. So please don't do that. You can turn to guidance people to help you, guide you through this process. And we're here to help you through it all. And even enrolling and going to your Social Security account and setting up a Social Security account will help you through that process as well. Our consultations, there's no cost for our consultations. So we'll help you through that process to find the right fit for you.
So again, a trusted advisor like ourselves, just to help you figure out those ABCDs of Medicare, right? As you always like to say, the alphabet soup.
That's right. So the good news is these mistakes are avoidable, and the right education and support can help you through this process.
Right. So we at Simplicity Group, we're here to help you and your family navigate the process through the ABCs and Ds of Medicare and all that, just to help you understand it. And like I said before, you may not come out on top knowing it all, but it's okay.
Absolutely.
We're going to make the process a little smoother for you.
And if you found this video helpful, make sure to like and subscribe and share it with someone you love, and share your comments. We'd love to pick some topics that our audience would like to see covered.
Right. So if you have any questions about Medicare and how to enroll in Medicare, please reach out to us, our team. We're always here to help you. Thanks for watching.